Hey, Mike, how you doing?
Good. How are you?
I'm doing great today. I've actually got some more questions for you. Do you mind?
Go ahead.
What are the different providers in a medically integrated office?
The different providers in a medically integrated office. Well, that would be a medical provider. So you'd need like an MD or a DO or an NP or a PA or some combination of all the above. It would be a chiropractor. It would be a physical therapist maybe, and maybe an acupuncturist, maybe a naturopath. Any of those would be the providers.
Nice. So the possibilities are endless then, huh?
That's right. Well, there's limited, but there's a lot of possibility.
What would you tell someone who is hesitant on taking the step towards medically integrating their office?
Well, you have a team. So when you're working with a team, you have other people to bounce ideas off of. It gets more creative. It gets more possibilities because you have different viewpoints. So having a team does give you a lot of resources. You have to make sure you're at a certain level, and I know our coaches won't let somebody start with us who's not at a certain level because we don't want them to get buried in trying to pay for everything. So we'll coach you on that. We even have programs to help people get up to that level if they're not there and they want to do integration.
What's the ideal size of a practice to start their transition into a medically integrated office?
Well, it's funny. If you're talking about chiropractors measure their practice by their number of visits. For example, I was doing 750 or over 700 visits a week, which is a lot. The average chiropractor sees between, 100 and 200 visits a week. But we don't measure that in a medical practice. In a medical practice, we're measuring volume because there's a lot of services. You're doing a lot of things to that patient to help them avoid a surgery or avoid an opioid prescription or antidepressant prescription, something to help them avoid medication and surgery. So there's more things you can do, trigger point injections or bracing or rehab or chiropractic. So we measure it by the volume of services and the dollar value. So I would say most practices that start with us are somewhere around $300,000 gross revenue a year. And then when we bring people into our fold, the majority of them go over $1 million within the first 18 months.
That's amazing.
Yeah.
How is a collaborative care model a better option for patients rather than individual or traditional medical care?
Well, it's a really good question because who benefits from this? Well, the patient benefits because they're getting more opinions and more services in the same area. They don't have to go from place to place to place to place. The practice benefits because they're delivering those services. The insurance companies actually benefit because the stuff that we're doing is less expensive than traditional medical, like surgery and opioids that never end. Opioids just keep going and going and going. So in the long run, patients get a beneficial outcome, they graduate and they're done and they fix their problem. So everybody benefits, except possibly maybe the pharmaceutical companies don't, because there's a lot less medications prescribed, and maybe not the surgeons either, because they're not getting surgery.
Wow, Mike. Well, thank you for these questions. I hope you're going to enjoy your quadruple shot cup of coffee.
My super strong coffee? Yeah, I'll be up for 2 days with this one.